Hello everybody, hello participants of WCCICC Mumbai 2023. My name is Jaroslaw Kasprzak. I'm a cardiologist from Medical University of Łódź in Poland, and it's my pleasure to share some of the pieces of my experience here with Indian and international colleagues. So my talk of today was echo approach to pulmonary hypertension, and pulmonary hypertension is a kind of a hot topic these years. It's contrary to common beliefs a very common problem, and it is divided into several types which are handled completely different ways and require different exercise. So by far the most common types of the problem are pulmonary hypertension linked to pulmonary disease and pulmonary hypertension caused by left heart cavity disease. So the typical scenario could be a hypoxic pulmonary disease with a degree of elevated pressures in pulmonary circulation, or a situation of patient with heart failure with typical HF-ref or HF-pef causing elevated pulmonary pressures. However, the real troublemaker is the arterial pulmonary hypertension, which is a sort of a specific disease of pulmonary vessels, and this one deserves a very dedicated and specific workup, and also treatment with the drugs which are not used beyond these specific indications. So echo is a very important part of the process, as emphasized in the recent guidelines from European Society of Cardiology. It is a prime screening modality on a pathway of a workup of patients with dyspnea as a leading symptom. So after we reject primary pulmonary causes, echo has to be used as a screening modality, and we have a combination of variables based on measurements of tricuspid regurgitation jet velocity, which is usually present in this type of patients, and combining that with phenotypic features, increasing or not increasing the probability of a real pulmonary hypertension, and they include abnormalities of right-sided cardiac filling, abnormalities of right ventricle and right atrium structural dilatation, and also some specific features of abnormal right ventricular ejection. So putting this all together, echo provides us the guideline whether the patient should be specifically directed to the pulmonary hypertension center with a prospect for immediate right heart catheterization to set the definitive diagnosis, or should just stay under supervision and controlled periodically. On top of that, there is a lot of numerical formulas which can assist in our reasoning with a suspected pulmonary hypertension. So it's not only judging the probability of pulmonary hypertension, although this is the main task for echocardiography if we look at in the guidelines. However, experts in echocardiography can quantify pulmonary pressures and also attempt to estimate the values of systolic, mean, and diastolic pulmonary pressure. And the very definition of pulmonary hypertension is based on mean pulmonary artery pressure. Even further, some hemodynamic variables which were traditionally restricted to invasive evaluation and measurement, such as pulmonary vascular resistance, also have been subject to echo research, and we do have formulas which give a very reasonable estimate, and knowing the estimate of pulmonary vascular resistance gives us a very valuable clue for differentiating the primary disease of pulmonary vasculature versus secondary due to pulmonic or left-sided problems, types of disease. And this drives the proper treatment, because when we are able to set the real diagnosis of pulmonary arterial hypertension, we need to look for specific therapies, including endothelin receptor blockers, including PDA5 inhibitors, and prostacyclin or prostacyclin analogs. So pulmonary hypertension has become a fascinating topic for clinical cardiologists, and currently echo is a very powerful tool we can use for proper directing of patients towards proper therapies.